Hello friends and welcome to the discussion of CBOT questions of forensic medicine. Let's take up our first question. The first question is a picture based question, and in the question you can see there are certain x-rays which are highlighted. Let's read the question. The question says, when a girl was reported missing from the town, the people informed the police that they believe she has been kidnapped by a guy. However, the girl later testified in the court that she is a major and was married to the man. Her wrist, elbow, and pelvis x-rays are shown in the picture. What is the girl's estimated age? Okay, so question बहुत clear है हमारे सामने. There are three x-rays which has been shown in the picture. The question is whether the female is major or not, which means the question asks whether the girl is greater than 18 years or not. Okay, see, this is the question in the picture, but the question actually asks us कि गर्ल की estimated age in x-rays के हिसाब से क्या हो सकती है. So let's have a look at the three x-rays which have been shown to us. The first x-ray is the x-ray of the elbow joint, and in that x-ray we can see complete fusion. You can see that all the epiphyses of the joint area are completely fused. In the second x-ray, that is x-ray of the wrist and hand, we can see that again there is complete fusion. We can see that the epiphysis of the lower end of radius is fused. That would be the last fusion that would happen in this x-ray. Okay, and in the third x-ray we see the lower half of the pelvis, where we can see at this area at the lower end there is fusion of ischium, right? So ischial tuberosity is also fused. Rather than ischium, I should write here ischial tuberosity. Okay, so if we look at the fusion table of these three very important x-rays for estimation of age, what do we see? We find that when we look at the elbow joint, if everything is fused, the age is 16 years. The last process to happen here is fusion of medial epicondyle of the lower end of humerus, and this happens close to 16 years, right? So if everything is fused, the person is more than 16 years. In the wrist joint, the last process to happen is fusion of lower end of radius. This fusion happens between 18 and 19 years. It means if the lower end of radius, the epiphyseal fusion has happened, the person is greater than 18 years. Okay, and in the hip joint, what we can see in the x-ray, the last process would be fusion of ischial tuberosity. This happens at 20 years. So if ischial tuberosity has fused, the person is more than 20 years. So the best answer that we get from these three x-rays is that the person in the question, that is the female, she is more than 20 years, which means the most appropriate answer it would be that she is above 18 years of age, right? So correct answer is option A. Let's move on to our next question. Section 314 of Indian Penal Code deals with, and then there are four options given: causing miscarriage without the consent of the mother, causing miscarriage with the consent of the mother, causing the death of the quick unborn child by an act amounting to culpable homicide, or death of the mother by an act done with intent to cause miscarriage. This question or question around criminal abortion punishments are very frequently being asked in the examination these days. Okay, the one thing that we should remember is section 312 to section 316 of IPC. They all punish for criminal abortion. Okay, what are the different scenarios and how much is their punishment? Let's see it. So the first section is 312. 312 punishes for abortion done not to save the life. If it is done like that, the punishment is 3 years of imprisonment. But if it is done on a woman who has experienced quickening, so woman who has experienced quickening and the abortion is done on her not to save the life, the punishment is 7 years. 313 punishes for abortion without consent of the woman. The punishment is 10 years of life imprisonment. 314 is death of a female due to an act with an intent to cause miscarriage. The punishment is 10 years. And if the act is done without her consent, the punishment escalates to life imprisonment. 315, as you can see, is punishment for preventing a child from being born alive or causing it to die after birth. Again, the punishment is 10 years. And 316 is act causing death of a quick unborn child. Again, punishment is 10 years. So what very importantly we see here is that punishment from 313 to 316 are all 10 years. ओके, सो एक चीज जो हमें याद रखनी है वो क्या है कि 313 से लेके 316 में मिनिमम 10 साल की पनिशमेंट तो है ही, बट क्वेश्चन में स्पेसिफिकली पूछा हुआ है कि 314 आईपीसी में कौन सी पनिशमेंट है, विच इज डेथ ऑफ अ फीमेल ड्यू टू एन एक्ट विद इंटेंट टू कॉज मिसकैरेज, राइट, विच मीन्स हमारा इस क्वेश्चन में करेक्ट आंसर क्या होगा? ऑप्शन डी, दैट वुड बी करेक्ट आंसर. Let's take our third question. After the delivery of a lady, one fetus gained live birth and the other was found dead and compressed in the uterus. Now this is a very important information. The other was found dead and compressed in the uterus. The father for some reason asked for a DNA testing. The live born child was discovered to not belong to him after testing. The best way to characterize this case is as, okay, so basically पूरे सिनारियो में हम देख क्या रहे हैं that a female has delivered one live birth, the other fetus is dead. Not only the fetus is dead, but it has a compressed body also. This condition is called as fetus papyraceus. This condition where the fetus is dead and compressed in the body is called as fetus papyraceus, right? This fetus papyraceus happens when two fetuses are growing in the utero, but one fetus which has a deficient or defective blood supply is overgrown by the other fetus, and because of the compressive effect of the growing fetus, the other fetus dies and is flattened. That is how it becomes a compressed fetus. So one fetus grows well, the growing fetus compresses the other fetus. This condition can happen in a situation called as superfecundation. So correct answer here is superfecundation. What is superfecundation? Two ovas released in the same ovulatory cycle getting fertilized by two separate acts of coitus. And these two separate acts of coitus can be done by two separate people or two separate men. And that is how two separate ova released in the same cycle gets fertilized, but one ova grows better than the other. As a result, the better growing fetus causes the other fetus to die and compress, called as fetus papacious. Right? This is superfecundation. On the other hand, there is another important word given in option B, which is called as superfetation. What is superfetation? Superfetation is a process where a female who is already pregnant with a fetus releases another ova during the first trimester. So sometimes during the first trimester, another ova can be released, and the second fertilization happens to that ova. Okay, and as a result, two separate binovular twins grow in the uterus. Both can grow differently, and different deliveries can happen, which may be separated by 1 to 3 months. So examples are there. So there is already a fetus present in the uterine cavity. Within the first trimester, another ova is getting released. Even that ova is getting fertilized, and two fetuses grow, and two separate deliveries, which can be distant from each other 1 to 3 months apart, can happen. This is superfetation. Okay, so what do we see in superfetation is that already pregnant lady, another ova release during first trimester of pregnancy, two fetus grow with different level of maturity, एंड उसकी डिलीवरी जो है वो सेपरेट हो सकती है. राइट, दिस इज सुपरफिटेशन. हमारे क्वेश्चन में क्या पूछा हुआ था कि कंप्रेस फीटस जो डिलीवर हुआ है वो क्या चीज है, वो सुपरफिकेंडेशन का एग्जांपल है. ओके, लेट्स टेक द नेक्स्ट क्वेश्चन. A male patient who has worked for previous 18 years in a matchbox industry present to a dentist with many sinuses, fistulae around his jaw. तो उसके jaw में बहुत सारे sinuses and fistulae है. Okay, and he is working in a matchbox industry. Now this is a very important information. कई बार हम questions में ये important information miss कर जाते हैं. Chronic एक्सपोजर टू सर्टन केमिकल, जो कि किसी ऑक्यूपेशनल सेटिंग में खासकर हो सकता है. ओके, द साइनसेस एंड द फिस्टुलास are draining with unpleasant smelling discharge. Which of the following substances is the reason behind this? इस तरीके के आंसर क्वेश्चन को आंसर करना बहुत सिंपल है. हमें ये पता होना चाहिए कि वो जिस इंडस्ट्री में काम कर रहा है वहां पर ऐसा कौन सा केमिकल, कौन सा कंपाउंड है जो ये कॉज कर सकता है. अमूमन तौर पे हमारे नीट पीजी एग्जामिनेशंस में, एनआईसीटी एग्जामिनेशंस में इस तरीके का एक क्वेश्चन आता है जहां पर द एग्जामिनर वांट्स टू असेस यू ऑन योर नॉलेज that whether you know what chemicals are preferentially used in certain industries, right? In this case, the matchbox industry or the incense industry, माचिस बनाने वाली, अगरबत्ती बनाने वाली जो इंडस्ट्रीज हैं वो पॉपुलरली यूटिलाइज करती हैं फॉस्फोरस. So correct answer here is phosphorus. And अगर मैं ज्यादा एक्यूरेटली कहूं, this is red phosphorus. Red phosphorus is used in the matchbox and incense industries, and workers who are working in these industries for a long period of time, they are very vulnerable to keep on inhaling the fumes of red phosphorus. Okay, this condition which is mentioned here, that is draining sinuses and fistulas, is called as phossy jaw. And this condition is the result of inhalation of fumes of red phosphorus. Right? So correct answer here is phosphorus. Next question. The cause of death was determined by doing an autopsy on a dead person. The examination revealed circular bruises on the neck. Okay. So if I were to draw, let's say, somebody's neck here, we are talking about these kind of circular bruises present on the neck, right? The fracture of the thyroid cartilage was also seen, and bruising of the subcutaneous tissue beneath the neck is also seen. What is the most likely reason of death? The answer is mugging, strangulation, hanging, or throttling. Now, what is the most important clinching factor which is giving in the question? Something that can really take you or jump you towards the answer is the circular bruises on the neck. These circular bruises on the neck, they are result of pressing on the neck by pulp of fingers. So when you take the fingertips and when you press the fingertips to compress the neck like this, the fingertips are going to create circular or slightly oval to circular kind of bruises in the neck, also called as six penny bruises. Remember, these are also called as six penny bruises because they resemble the size of a 6 penny coin, right? And this procedure is called as throttling, compression of neck by bare hand. Okay, so correct answer here is simply throttling, right? Next, a girl 17 years old was brought to the OPD. When examined, the hymen is intact, vagina is spacious, the labia majora are separated, and the labia minora are flabby. What can be considered possible? See, if you read in this question, there are few findings which are very consistent with the girl having sexual intercourse, also known as habitual, somebody who has experienced sexual intercourse or somebody who has lost her virginity or somebody who is not a virgin. But one finding which is very consistent with the virginity of the female is intact hymen. So although she has an intact hymen, but her vagina is spacious, labia majora is separated, it is not covering labia minora, okay, and labia minora itself is given as flabby. So how can these two things coexist together? That some findings are consistent with a habitual female and one finding is consistent with intactness of her virginity, which means she is someone who has experienced sexual intercourse, but hymen tells that she is virgin. These kind of females are called as pseudo virgins or false virgin. They are not true virgin females. So correct answer here is pseudo virgins or false virgin. So let's say, who is a pseudo virgin or a false virgin? A female who has experienced sexual intercourse but her hymen is intact. Now, hymen is a structure which gets ruptured as soon as primary sexual intercourse. So, intactness of hymen highly is suggestive of a female being virgin, right? But on clinical examination, as we have seen that the other signs are consistent with her having sexual intercourse, it means she is someone who has experienced sexual intercourse but hymen is intact. The reason is that these females may have a very fleshy hymen, so that when a penile penetration is attempted, the hymen doesn't get ruptured but it rather dilates, so that it creates a track for penile entry into the vagina. But when she is examined, the hymen is found intact. Okay, so let's see what are the differences between a true virgin and a pseudo virgin. So when we examine such a clinical case, what are the findings that we may see? The first is hymen. Now in both the cases, the hymen is going to be intact. But in true virgin, it is not only intact, it does not permit more than a fingertip, right? But in pseudo virgin or a female who has experienced sexual intercourse, because the hymen would be dilated, it would admit 1 to 2 fingers. So when you do a PV examination, you can make that difference. Second is labia majora. In true virgin, it will be apposed, whereas in pseudo virgin or false virgin, it will be open, right? Third is fossa navicularis. It will be seen as intact in a true virgin, whereas it would have disappeared due to sexual intercourse. It would have disappeared in a false virgin. And fourth is vagina itself. In true virgin, the vaginal walls will be apposed, whereas in false virgin, there will be roomy vagina. Because of the repeated penile penetration, the vaginal wall will separate, so the vagina will be felt roomy. There is a lot of space in the vagina. So these are the differences that we can see in examination of true virgin versus false virgin. Next question. The prosecution files an appeal after the defense lawyer asks a leading question. During the court hearing, the appeal is accepted by the judge. Okay. Out of the given options, leading questions are not allowed with the exception of. So question basically is asked in an indirect form where the question wants to ask leading questions कब allowed होते हैं. और ये क्वेश्चंस रिपीटेडली काफ़ी बार एग्जामिनेशन में पूछा गया है डिफरेंट डिफरेंट फ्रेजिंग के अंदर डिफरेंट तरीके से कई बारी कुछ सिचुएशंस देख करके और हर स्टूडेंट को ये चीज़ मालूम होनी चाहिए leading questions can be asked during cross examination. Correct answer is cross examination, right? Leading questions एग्जामिनेशन इन चीफ में नहीं पूछ सकते, री एग्जामिनेशन इन चीफ में भी नहीं पूछ सकते और डाइंग डिक्लेरेशन में भी डाइंग डिक्लेरेशन रिकॉर्ड नहीं करी जाती विक्टिम से उससे लीडिंग क्वेश्चन पूछ के. तो डाइंग डिक्लेरेशन इज रिकॉर्डेड इन प्लेन एंड सिंपल वर्ड्स. जो भी विक्टिम बोलना चाहता है उसी के वर्ड्स में. नो लीडिंग क्वेश्चंस आर आस्क्ड टू द विक्टिम. व्हाट आर लीडिंग क्वेश्चंस? लीडिंग क्वेश्चंस आर दोज काइंड ऑफ क्वेश्चंस वेयर द आंसरर यानी कि जो विटनेस है जिससे वो सवाल पूछा जा रहा है he has to answer in yes or no. So you lead the witness to a point where all he has to do is say yes or no. Okay. Next question is, if farmer felt something bite his leg while he slept in the field. Something was slowly backing away from him. After that he became sleepy and was brought to the hospital. He started to feel discomfort in the same area of the cut and the bleeding from it continued. So important thing which is given here is a very continuous bleeding. The cut turned red and developed blisters. Okay, so there is a history of development of blisters also. What is the most likely reason among the following? Okay, so we are talking about a farm field and some kind of a sting that a person felt in his lower limb while he was sleeping, and he saw something backing away from him, and later on there is continuous bleeding from that area and also development of blisters. Okay, this thing is consistent with a snake bite. The only thing that we need to differentiate here is what kind of snake. Does it look to be a neurotoxic snake or it does look to be a vasculotoxic or hemotoxic snake? Okay, so if we read the question completely, development of blisters, continuous bleeding from the site of bite is consistent with a hemotoxic snake bite, which means this snake would be viper. Out of the two options A and B, viper and cobra, cobra is a neurotoxic snake and viper is a hemotoxic snake, right? So this is consistent with a viper bite, right? Okay, with that we come to the end of discussion. Stay hard in your preparation and keep faith. See you next time. Bye.